Hello, everybody. I think because I'm a couple of minutes late, we can probably kick off and people have had a bit of time to join. So welcome, everyone, to our second in our series of BHF Data Science Centre monthly seminars being presented as webinars for obvious reasons. It's very nice to see everybody. I will be surveying who's here during the first talk because I haven't had a chance to do that as yet. But anyway, it's a great pleasure to be able to introduce two talks today. So the first of those is going to come from the BHF Data Science Centre team, and they're going to give an update across our portfolio of work, focusing on some of the new areas of work, and also talking a little bit about our communications and patient and public involvement programme. And then second up, we have a guest speaker today, Seamus Kent from NICE, who's going to talk to us about their Methods and Standards Programme for Data and Analytics. For those of you involved in the CVD COVID UK consortium, you'll be aware that NICE are represented in that consortium and have been quite involved in thinking about some of the projects and ways in which they might use the data in the various trusted research environments, perhaps in particular in England, because that's an important part of their patch, as it were. So we really look forward to hearing from Seamus in the second half of our seminar today. So without further ado, I'm going to hand over to the BHF Data Science Centre and ask them to tell us all about what's going on.
Thanks very much, Kathy. So I'm just going to give a very brief overview about the BHF Data Science Centre, then I'll hand over to Jackie, who will discuss more of the new areas of work that we've just started, and then Debbie, who's a comms and engagement manager, who will talk around communications and patient public involvement. So next slide, please, Jackie. I'm sure a lot of you know, but the BHF Data Science Centre is a partnership between Health Data Research UK and the British Heart Foundation. And the centre itself is embedded within HDR UK. It launched just over a year ago on the 1st of January 2020 when Kathy took her post as director, and we've been slowly building the team since then. We have an initial investment of 10 million from the BHF over the first 5 years, and we have the ambition to grow that. And we work closely with a wide range of stakeholders, some of which are listed on this slide. And it's not just about promoting safe and ethical use of data for research, but actually facilitating and enabling that, particularly for the cardiovascular community. And so our vision is very much, we are the cardiovascular wing of HDR UK. So it's about improving the cardiovascular health of the nation by using large-scale data and applied analytics. So next slide, please. So this is our team. So at the top is Lydia Martin, who's is Kathy's EA, but also provides a huge amount of project management support and administration and keeps us all organised. Debbie is a communications and engagement manager, and you'll hear from her later. Reuven, I'm sure a lot of you know already. He's a research project manager, and particularly on CVD COVID UK. It's a particularly terrible picture of the operations director too. And then Jackie, who you'll hear from in a minute, she's talking about some of the work she's been doing around clinical trials and personal monitoring. And then last but not least, our leader, Kathy. Next slide, please. And this is just what we call the Wheel of Fortune, which is our wheel of activity, sort of thematic areas and cross-cutting activity that we do within the BHF Data Science Centre. So the 6 segments that you see are the thematic areas or work streams, and the first one is structured data. So this is about improving access, sort of quality, linkage, and better use of structured data. So these are things like electronic health records. So those of you that work on the CVD COVID UK project, that's where that project sits under that particular thematic area. And so those that don't know about CVD COVID UK, I'm not necessarily going to talk about that today, but it's about linking routinely collected population-wide health data to look at and making that available in trusted research environments to look at the relationship between cardiovascular disease and COVID-19. And you can find more information about this on our website. There'll be links at the end of this talk. And there were a couple of talks in the last webinar that discussed some of this, and they'll soon be available on our YouTube site. So you can find out more there. And the next webinar will actually have more information on that as well. The second segment is unstructured data, so doing something very similar to what I've discussed with structured data, but unstructured, I mean things like imaging data, free text, or sort of electrocardiograms, things like that. Personal monitoring data is a particular type of unstructured data, so looking at things like apps and wearables and linking that to other types of healthcare data, so you can start to look at disease trajectories and also management of disease. Computable phenotypes is the fourth one, and that's representing cardiovascular health and disease in machine-readable format, and then developing tools and protocols for the community to share and reuse. The next is around population and disease-based cohorts. So that's looking at various cohorts and again linking them with other types of healthcare data, such as the routinely collected healthcare data, so that we can start to understand the causes of disease, but also start to look at personalised strategies of treatment and prevention. And then finally, it's data-enabled clinical trials. So this is looking at using routinely collected healthcare data to streamline and make more efficient clinical trials. So whether this is in the sort of planning and recruitment phase or actually more of the outcomes and follow-up. So those are our sort of 6 themes of work. And then in the blob in the middle is the coordination and engagement, which is one of our cross-cutting activities, which provides the leadership, the project management, the support and comms and engagement to glue all of that together. Around the outside, we have driver projects, which, so exemplar or driver projects, these are the sort of things like the CV Covered UK project that will actually drive the progress within these different thematic areas. And then the grey arrow, which isn't labelled, is our talent and training programme. So we have a budget to fund a couple of PhD students and also some research fellows to actually work in health data science within the cardiovascular space. And we actually will partner with others, which we are looking to do with the PhD studentships initially, so that they form a large part of a large cohort within the health data science space. So that's a very whistle-stop tour about what's going on within the BHF Data Science Centre, and I'll hand over to Jackie to talk specifically about a couple of areas that she's been working on.
Sorry, it's just stopped. I just frozen. There we go. So I think you can see the personal monitoring data slide. So we've just started doing some work in this area. So personal monitoring data, as Lynn mentioned, is data from wearables such as Fitbit and Apple Watch and apps. It represents a huge wealth of unexploited information, which, if available, linked to health records, could help advance understanding into the causes and consequences of cardiovascular disease. However, as I'm sure you can imagine, there's a huge amount of challenges associated with accessing and linking to this data, such as privacy concerns, establishing consent, data storage and access, and linkage to health data sets. Our aim in this area is to create a population scale wearables data set with linkage to health data. So to start off our work in this area, we're beginning with organising an initial scoping workshop, which will bring together experts in the field along with other key stakeholders. This will be a small interactive workshop to discuss the opportunities and challenges associated with creating this linked data set. So coming out of this workshop, we're hoping to define some next steps, and we'll then be following up with additional work to solicit input from the wider community. We'll also be advertising for a lead in this area in the next couple of weeks. Another area that we just started looking at is data-enabled clinical trials. In the organisation and follow-up of clinical trials, the use of routinely collected healthcare data could deliver more efficient and cost-effective trials. However, there are sort of challenges associated with using this type of data. Our aim in this area is to streamline the use of routinely collected healthcare data for trial planning, recruitment, or follow-up. So to start off the work in this area and help us prioritise how we can best use our resources to help users of this data, we're investigating the use of this data to identify the challenges that users face. And we've carried out a survey which we sent out, we emailed directly to contacts at clinical trials units. It's also distributed via mailing lists and newsletters to professional groups and via Twitter. It just ended earlier this week, so we're just looking at the preliminary results now. We have 56 responses. 35 of these individuals had used routinely collected healthcare data in cardiovascular clinical trials. And you can see in the plot on the right, these are issues that were identified as presenting a considerable challenge to the use of routinely collected data by respondents to this survey. And there were 25 people that responded to this question. So you can see in the plot that the main challenges were the ease of data access, timely data access, and data availability. And in particular, when you look at the detail that respondents provided, they cited complicated and time-consuming approvals process, governance, and delays in accessing data. So we'll be going through the survey results in more detail. We also interviewed for a lead in this area yesterday, so hopefully we'll have some news on that soon. I'm now going to pass over to Debbie, who's going to run through our public engagement and communications.
Thanks, Jackie. Yes, so I look after communications, engagement and patient and public involvement for the BHF Data Science Centre. And you can see on the bottom of this slide, so our kind of vision around patient and public involvement engagement is around kind of really trying to work in a partnership with patients and the public to really ensure that the patient involvement work is fully embedded across the key areas of the work of the BHF Data Science Centre. So at the moment, I'm finalising a comms and engagement strategy, which will have a significant component of patient involvement, which will be going to our current lay members for their feedback before continuing further. But you can see on this this slide, using the same wheel that you saw earlier, we've currently got 4 lay members recruited who are part of the Approvals and Oversight Board for the CVD COVID UK Consortium. And they have been very supportive in sort of looking over project proposals, supporting lay summaries, providing lay commentary pieces, and the kind of asks for that group are starting to increase. So we're really looking at how to best continue to support that area of our work. We also have 1 lay member recruited who forms part of our governance, so sits on the Centre Oversight Committee, offering patient involvement, oversight and support right at the heart of what we do. Into the next slide, please. So then coming up next, we're really looking at, personal monitoring was something that was mentioned earlier. So our next planned stages for patient and public involvement is seeking to recruit some lay members who will be able to specifically support the work that's beginning around personal monitoring data. And also we've been trying to map out our patient involvement and engagement work across each of the segments in the wheel. So one of the things we'll be discussing with our lay members is around the potential for having a wider patient panel, potentially with individuals aligned to different aspects of our key work streams to ensure that we're really supporting each of those areas as best we can with that work. And also one of the things that I'll be considering is the ways that we can encourage and support patient involvement work beyond a more traditional panel model. So which areas of our work will be appropriate to have focus groups, to have email surveys, to potentially capture a wider span of voices, and for people to be able to dip in and out and have ad hoc involvement with the centre based around the capacity and needs of our patient members. Next slide, please, Jackie. So one of the things that will be really helpful is I'm trying to map out where there is also existing PPI support, either at host institutions or with local contacts or bespoke patient groups. So if you're aware of any kind of existing networks or key contacts or supports at your host institution or organisations that you've used before, I'd really appreciate it if you could drop me an email with some details of that, so we can really try and build up a good picture of what PPI support there is and that will be able to support our work going forwards. And next slide, please, Jackie.
I'm having a bit of a freezing issue. Yeah.
Okay.
Trying. There you go.
Thank you for the contact already, Ashley, in the chat. That's really helpful. And then just finally, to pick out some examples around the communications work. So again, I'm sort of working out best approaches to really begin our communications approach for the BHF Data Science Centre. So we launched our new Twitter account, which is at BHF Data Science, on the 9th of February. So please do give us a follow if you're on Twitter, haven't already. And you can see here with the outputs for the descriptive paper from the CVD COVID UK consortium, you can really see the kind of reach that we've started to gather from this, with examples of news on the HDR UK website, also from Health Tech News, who've picked up on that story as well. So really keen to continue to expand our approach and reach with the communications that we do. And next slide, please, Jackie.
Trying to change my. There you go. It's coming through.
Thank you. Thanks to everyone who's already put in contacts in the chat. That's really helpful. And I can see Will's on the call, but this is just an example of how we're really trying to work with partner teams who work in communications. So from the British Heart Foundation, we have monthly calls with their research comms team to make sure we're really aligning the comms that we do overall and supporting each other. And here's an example of some funding that was awarded by the Stroke Association. So the comms approach for the announcement of this was led by the Stroke Association, very strongly supported by Will, who put a huge amount of effort into providing his time and producing video content to support this coverage. And you can see this was picked up with over 300 email and a really strong video that Will filmed of himself talking about the work, was then edited with a really strong patient story, which then had over 42,000 impressions on social media. So a really lovely example of how we can try and support and enhance the work of our comms partners where we can. And final slide, I think, from me, Jackie, if it will go.
Sorry, my internet connection is unstable.
I can preempt it. So
again, yeah.
So as I'd asked for the patient and public involvement contacts, again, we're really trying to broaden our connections with the communications teams that are based within host institutions. So for example, with the previous slide, the team at the Edinburgh University Press team were really supportive. So to try and make sure that I've got a really good picture of the comms teams and contacts across the organisations that we work with, again, it would be really helpful if you could drop me an email just with the name and contact email of the comms or media lead at your host institution, just so then I can really start to map out where we can start to work together and collaborate on that. And also any other kind of media or trade contacts that you might have had success with before, who've been warm to your research news. That would be really fantastic. So please do drop me an email, I can follow that up. And then the final slide really is just highlighting some of the different links for you to find out more about our work, including some Twitter, email, the website, the recent descriptive paper links. And we'll leave this slide up just while we take some questions.